Hello, today our topic of discussion is hyoid bone. As you can see from this diagram, the hyoid bone is situated in the anterior part of the neck below the mandible, or we can say that between the chin and the thyroid cartilage. It's a U-shaped bone, small but significant bone. It's the only bone in the body that is not attached to any other bone. Rather, it is suspended through ligaments. As you can see, the stylohyoid ligament. It is suspended through ligaments and muscles. Hence, it is also called a free-floating bone. Its relationship with the surrounding structure is that mandible is situated superiorly, thyroid cartilage and larynx is situated inferiorly, while epiglottis and pharynx is situated posteriorly. It is at the level of C3-C4 vertebrae. The hyoid bone provides attachment to the muscles of the floor of the mouth and the tongue, and therefore aids in the tongue movement and swallowing. Now coming to the structure. Coming to the structure of the bone, it has a central part or body and two pairs of cornu or horns. This is the body and these two pairs of cornu or horns on each side of the body, called the greater cornu and the lesser cornu. Cornu means horns. The body is quadrilateral structure and it has got anterior surface, posterior surface and two borders, the superior border and the inferior border. The anterior surface is convex and is anterosuperiorly directed. A transverse line crosses it in the middle, dividing it into an upper and lower halves. In some cases, rarely, a vertical meridian ridge divides it into two lateral halves. The back surface of the body of the hyoid bone is concave and directed postero-inferiorly. It is separated from epiglottis by the thyrohyoid membrane and loose areolar tissue. A bursa intervenes between it and the thyrohyoid membrane. Now coming to the greater cornu, it projects from the side of the body of the hyoid, running posteriorly, flattened from above downwards, tapering at the end in the form of a tubercle. The lesser horns are small conical projections attached by their bases to the junction of the body with the greater cornu. They are attached to the body with the fibrous tissue, and occasionally they form synovial joints with the greater cornu. These synovial joints in some cases become ankylosed later in life. Coming to the muscle attachment. Attached to most of the body's anterior surface is the geniohyoid muscle, which is attached both above and below the transverse ridge, which divides the anterior part of the body into halves in the depression called the geniohyoid area. Medial part of the hyoglossus muscle invades lateral geniohyoid area. Now the lower half of the anterior surface of the body gives attachment to the mylohyoid muscle just above the sternohyoid muscle medially and the omohyoid laterally. To the superior border of the body are attached lost fibers of genioglossus, the hyoepiglottic ligament, and the thyrohyoid membrane, which is most posteriorly attached. The inferior border gives attachment to sternohyoid fibers medially in the same way and omohyoid laterally. And occasionally medial fibers of thyrohyoid muscle and levator glandulae thyroideae are attached to it. To the upper surfaces of each greater cornu, the middle pharyngeal constrictor muscle and more laterally the hyoglossus muscle are attached throughout its entire length. Near the junction of the cornu with the body, the stylohyoid muscle is attached. A little posterior to this is the fibrous loop for the digastric muscle tendon. As we know, digastric is a muscle of the floor of the mouth with two bellies. That is why it's so named digastric, that are joined together by tendon. So that tendon passes through this fibrous loop. To the medial border of the great cornu is attached thyrohyoid membrane, and to the lateral border is the thyrohyoid muscle. The oblique inferior border or surface of the greater cornu is separated from thyrohyoid membrane by loose areolar tissue. Now coming to the lesser cornu. At the posterior and lateral aspect of the lesser cornu are attached middle pharyngeal constrictor muscles. To their apices are attached stylohyoid ligament. And to the medial aspect of their bases are chondroglossi. So we can say that the stylohyoid ligament are attached to the apices of the lesser cornu and to the styloid process of the temporal bone. The ossification proceeds from 6 centers. Ossification of hyoid bone proceeds from 6 centers, a pair for the body and 2 for each cornu. That is 2 for the body and 2 for each cornu, 6 in total. Commencing in the body around the time of birth or shortly afterwards up to 4 months of age. In the greater cornu by about 6 months of age, while that in the lesser cornu occurs at puberty around about 15 years of age. The greater cornual apices remain cartilaginous by about 3rd decade of life, and epiphysis may occur there. Development of the hyoid bone is from 2nd and 3rd visceral arches. The lesser cornu developed from the 2nd visceral arch and the greater cornu from the 3rd visceral arch, while the body evolved from ventral fusion of the ends of the both. Now coming to the clinical significance, hyoid bone is important to a number of physiological functions including breathing, swallowing and speech, due to all the muscles attached to it, which are the muscles of the floor of the mouth and tongue. It also supports the epiglottis through the hyoepiglottic ligament. It is thought to keep the upper airway open during sleep. Hence, it's important in the development and treatment of obstructive sleep apnea syndrome. This obstructive sleep apnea syndrome is characterized by repetitive collapse of upper airway during sleep. Clinical studies show a more inferiorly placed hyoid bone is associated. Clinical studies show a more inferiorly placed hyoid bone is associated with the severity of the disease, which is the sleep apnea syndrome. A surgical procedure called hyoid suspension surgery aims to improve the airway. Its forensic significance is that in suspected cases of murder or physical abuse of an adult, a fractured hyoid strongly indicates throttling or strangulation. It is also the first bone to break in judicial hanging. However, in children and adolescents, since the ossification has not yet completed and the bone is still flexible, it may remain unaffected even in case of serious trauma. So that was a brief review of the hyoid bone. Don't forget to subscribe and share for upcoming topics. Thank you so much.